Traditionally, a radiologist is charged with interpreting medical images. An interventional radiologist uses the tools that we have in the radiology department, CT and fluoroscopy and ultrasound, to perform procedures on patients. When it comes to cancer specifically, we use those tools to direct therapies and biopsies or for diagnosis. So that might be a needle biopsy. That might also be a more complex procedure like an ablation of an actual tumor that we know exists in the liver or kidneys or bones. We can go in with special needle devices and treat those tumors. Frequently when we obtain a biopsy, we deliver that tissue directly to the pathologist while the patient may still be sedated during the procedure, and they can do some rapid, what we call touch preps, to determine if the tissue is one, abnormal, but two, is it viable for testing to determine the exact tissue type. So we absolutely work hand in hand with the pathologist to make sure our patients are getting the most accurate and timely diagnosis. We have a device called the intact breast biopsy system or breast lesion excision system, where we can go in through a 1/4 inch incision in the skin and remove breast tumors up to 2 centimeters in size. As far as lung cancer, Lake Charles Memorial offers low-dose lung cancer screening CT scans. And those are for patients who have a high risk for developing lung cancer due to occupational exposure or a long smoking history. We have a quite extensive team, and that's one of the nice aspects of Lake Charles Memorial, is that we really have everyone on site to provide comprehensive cancer care. A team approach is always better than one physician making a solo decision on patients. I think the advantage of Lake Charles Memorial is that we know our patients well. We're not a cancer mill. We really provide personalized service for our patients. So we're going to know their name when they walk in. We're going to know what they have. We're going to remember their last visit. I do think that's one of the advantages of a community level cancer program versus some of the tertiary centers. We all know that patients who have had a recent diagnosis of cancer face some of the most emotionally challenging times. The physicians at Memorial really make an effort to let them know that we care about them as an individual and that we're working hard to make sure that they can get the most quality of life moving forward as possible. As part of the team that takes care of these patients, it makes us feel great that we're able to provide some quality of life for those patients. Obviously, a diagnosis of cancer and the treatment of cancer can be quite challenging for those patients. We want them to look forward to quality of life, and we provide that by the personalized service that we provide. We also have cancer support groups who help walk those patients through the process. We also have a patient navigator who also walk those patients through the processes at the hospital to make sure that we do what we can to facilitate a good experience at the hospital.